first grade. Then we moved out to Clay Township and went to Christ the King. Yeah, that's in your inbox, so that will be something that you certainly will be able to figure out.
I think we're running a lot more efficient than that. That's what I think.
Yeah, good. Second here. It's on. All right, I think we'll get started. Welcome everyone to our Wednesday press conference, COVID press conference. We've certainly got a continued amount of good things happening in the community, and we'll get to Health Department's report here in a moment, joined by Teresa Reed from the Kosciuszko County Health Department, Kurt Carlson from Bowen Center and our COVID hotline and testing site over at the fairgrounds, and Commissioner Carrie Groninger. So as we've evolved into this thing, I think we're really focusing on the vaccination side of it. And before we get into that discussion, I just want I'd ask Teresa to maybe give us the most current numbers, and our state advisory level I think will change at noon today. So Teresa, you want to talk a little bit about the numbers?
Kosciuszko County, as of this morning, using the state publicly available numbers, which is 8,567 cases. We have had 111 deaths. Now that death number has been going up some, but the state has gone back and found data. They're adding to those. That's some of the death numbers that have increased are not looking at current deaths. So I'm seeing that changing. So we're looking great. As of this morning, the last 3 days of this week, we had 14 cases. So much happier with those numbers. For monthly numbers, February brought us down to 350 cases. So that's the least we've had since September. September was 270s, 280, and then went up to over 1,000 in October. So this is we like to see this big pretty curve here that goes nice up and down, and now we're down. Our curves follow the state of Indiana. We can look at their curve, and it's very similar, just as the country's curve follows. So then the next thing, so cases are doing well, and the next big thing is vaccines. And the vaccine clinic's been running since January 11th this year. And total, they have vaccinated at KCHD Clinic over 8,040 people. So that was as of yesterday's numbers. When we get into today's a full day again. The clinic's running, since they've changed the criteria again, we're running near the maximum capacity with around 350 a day on average coming in. There's a slightly larger capacity because we can overbook, but we don't have time to overbook, to be honest. So that's going great. In January, there were 1,777 vaccines given through the KCHD clinic, and February had 5,559 vaccines given. And March 1 and 2 had 704 vaccines given. So a big thank you to Jeannie DeWild. She's a chief public health nurse and runs the vaccine clinic. And she is working very hard for the community right now. Everyone, it's really all hands on, it's maxed. There are lots of things going on, and we're gonna keep looking at how to grow according to the community's needs. If someone needs an appointment right now, as of this morning, going in as a general member of the population, pretending I was someone to get an appointment, I could get an appointment as of March 15th. So we are watching that availability to make sure that we're keeping a reasonable capacity. So, as we come into this time frame, the people who have died in Kosciuszko County, over 97% of them were over the age of 50. So as we are able to have this vaccine available, it's really nice because it's available to the populations that are at highest risk. And Indiana is looking at scaling this out as quickly as they can. They have a very ambitious plan laid out. So that's what I think of.
Good, good. I've got a kind of a specific question I'd like you to maybe address or see what you know about. Talking to our fire department this morning, they've been notified by Homeland Security that they're going to be involved in this homebound vaccination project where, excuse me, evidently extra doses at the end of the day. We call an EMT or a fireman who's able to give a shot, and they take those doses out to a registry of homebound patients. Number one, how does one get on that homebound list? What list is being used? And I know, Kurt, I've heard you talk about that as well, too. Can maybe Jeannie or Teresa, you can talk about first, and then Kurt, you can jump in. Who is eligible for that type of care? Because it sounds like that's going to start potentially next week.
Right, and I know that we haven't quite been ready to get there yet. I know that we are able to accommodate people who, just on another aside, in the routine clinics, if someone has a difficulty getting out of their car, an extreme difficulty or something, they can ask for accommodations. Their caregiver can, and we can. I know they've given shots in cars and things.
Okay.
Also, the homebound status, I think it's a matter of having the ability to get that list put together.
Right.
For the current time at the health department, we've ran a risk. So if we come to the end of the day, each vial has 10 doses in it. If you end up with extra doses, you have those few doses to give out. So that's what they're going to use to help reach those homebound. Although if we have adequate, there's no reason we couldn't administer to homebound in other ways too.
Sure.
With that, I would assume. But that program's just not quite live yet here.
Right.
But it's available. We've been able to not waste any doses. We do maintain a call list so that we know how to reach people if we hit the end of the day and we go, uh-oh, we need to use 3 doses so that we can get those used in an effective manner.
Yeah, like everything through this whole pandemic, that program is still evolving.
It's evolving.
And probably all of a sudden we'll hear that it's live. So,
Yep.
But just kind of trying to stay a little ahead of it. Kurt, I know you'd made mention of the eligibility list criteria. Anything you can share on that?
Yeah, a couple things. Laura Morse is our infection control nurse. She was listening in to the governor's press conference last week, and we both misheard that they were extending out to people with a number of chronic medical diseases. What they really meant to say, or what we should have heard them say, is they're going to roll those out to a date to be determined. And so already I think 2 on that list have been approved to be able to get the shot irrespective of age. And so, and again, like Teresa's talking about the homebound persons, that's another way to extend who is eligible to get the vaccine, who's most vulnerable to the disease.
Okay. All right. Thank you. Do you want to talk a little bit about testing right now and then kind of get into the hotline?
Sure, glad to, Mayor. So testing everywhere is down. We are doing an average of about 36 persons per day. So last week we did 174 tests. So we're up to having done a total of 14,234 tests since we opened. So that's still working. People are still accessing it. We've made ourselves available to all the school systems in the county because the state notified the schools that they would send them rapid tests, and they were expected to set up conditions and have the staff do testing of their students and faculty. And the schools were frankly relieved that we were willing to do that for them. And we have been doing those testings for those schools. And then every other week we give them the report back so they can enter that into the database that they're expected to report to the state. So it took, like everything else, the data we were giving them first was necessary, but more data was needed. So we changed our process so we can collect all the data that the school has to then enter into the computer system. Again, this is, it's a Herculean effort, and so there's no criticism of that. It's just an observation that this is ever evolving, ever changing.
Kurt, before you jump into the hotline, could you just quickly remind folks of your hours for testing?
Yes, that is essentially any day from 11 to 6, and then there are 2 days that are 10 to 7.
Just Monday through Friday?
Yeah, it's just, yes, we did close on Saturday because we're having very few people show up.
Okay, so looks like 11 to 6 or 10 to 7, Monday through Friday. Okay, great. All right. Hotline.
Yeah, I think as Teresa gave you the feedback earlier, people who use the hotline have been very grateful, and it's worked very smoothly for them. Of all the people who call, some people still call just to get information. They're still not convinced yet, and they just want a little bit more information. So we're glad to give that. But so far, we have registered 78 persons through the hotline, and 25 of those were Spanish speakers. So it's actually achieving its purpose, which is, since the state website's only in English, those are 25 persons who would not have been able to access the vaccination. And the others were older persons and others who have trouble with computers or don't have access to computer to get registered. So we've helped that many and answered questions for others.
All right, so Kurt, that phone number again?
I think you have it. I don't call it. Do you have it from your newspaper article?
Yeah, I'm going to find it before we're done here. I said it the other night twice. I'll find it.
Okay.
So we'll get that out. And again, I see the hotline is becoming even more critical as our numbers do tend to ramp up. Teresa, I know we've talked a bit about.
They have found the number.
Okay.
It's 574-347-4256. I was looking in the wrong place.
Okay. 574-347-4256. And those lines are manned basically during these same hours, or?
Yeah, 11 to 7.
Okay, very good.
Again, 5 days a week, Monday through Friday.
All right. Okay. So one of the first questions that came across, and we had some discussion about this, so I'll kind of turn this over to Teresa, and we can add a little bit to it, but let's see. So do you expect there will be a mass vaccination clinic in Kosciuszko County, and how soon might that happen, and are plans in place? We have made plans for potentially a second clinic. We don't have a Yankee Stadium, We don't have a Staples Center, but we've been looking at potentially down at the Center Lake Pavilion as being able to accommodate that type of activity. Plans are all very preliminary because we're trying to get ahead of it so that if there's a need for a second clinic, we're ready to go. And as you've heard in these weekly press conferences, we're often not notified, especially Bob Weaver at the health department. All of a sudden he'll get a call, you're getting, X number more doses, or all of a sudden without warning, they've lowered the age range. And these are all good things, but all of a sudden it's out there and the public expects us to accommodate. So we certainly want to be able to facilitate these quick pivots as more vaccines come available. Actually, we were down during the snowstorm, so it's not super predictable, but the answer to the question that there are definitely plans in place, and I think we will be ready to go when the need occurs. Teresa, from a health department perspective, I know you all have done a wonderful job as far as your efficiency out at the K-21 Pavilion. Everyone I talked to said it's just smooth, slick, in, out, and paced at a very regular, and you mentioned Jeannie DeWild and her staff out there. They're just knocking it out of the park with how they've set it up and how we're able to get these mass vaccinations to the public. We're just trying to anticipate maybe a capacity issue, but that's going to be a call the health department will make when they're given the doses, the ability to register those folks, and the need for, as Dr. Remington says, more serving lines. So you want to talk a little bit about how you guys are thinking this might work out?
Well, we just have the whole variety is open to us as to what we may need to do. We know that the Johnson & Johnson vaccine is probably a little easier to do mass vaccination clinics with because it's a one dose, one shot kind of a thing. So for one thing, as we look at this from a very pragmatic manner, we want to get everybody done. But this is not a vaccine that's being done without appointments. Please, as I'll just emphasize this point, people do need to have their appointments for this vaccine. They need to be ready. Even the mass clinics that are planned from the state are requiring appointments ahead of time. At the current, at the current capacities, people can't walk in and get in. There was a little while where we were able to do that and we could really accommodate people, but right now, while everything's running a little more maxed, but yeah, we're just looking at all the options and ready to increase those lines as we need to serve the community. But we got to see how many vaccines we get from, particularly, the next one that we're going to look at is that Johnson & Johnson vaccine, since that would be, if we are going to do a mass clinic, that's one of the places to do it. It's also, I know from my perspective, I'm impressed at how the clinic flows. Even though we're doing 300 a day, I've seen mass clinics where we only manage to do 300. And so while we have these other systems, I think we're going to have to see how it goes, and if we need it, we'll do it. And until then, we're going to figure out how to make it so people can get what they need.
Yeah, I think the health department's been very efficient at delivering these levels that we're at right now, but we all want those levels to increase because we want to have the availability and get to the end game here. So we are indeed looking at all those issues and opportunities to expand to potentially another site, and we'll be ready to go when the call comes from the health department. So another question that's come through from Mr. Spalding, with President Biden's announcement that enough vaccine will be available to cover all adults by the end of May, does it appear we are turning the corner? We got to get those shots in arms.
I am really happy with where the rates are right now. I really love the fact that we have this curve. It's given us a nice curve, and at a minimum right now, great. We have this quieter time to take care of these vaccines. It's just, Ubulant. Ubulant is a good word for me right now on that. Ubulant.
You've been through some of these well, not necessarily pandemics, but
This is no second.
public health issues. You know, so I really respect your perspective on where we're at. And, you know, you called right from the get-go. You said, we're going to have 2 waves. You know, we're going to have this first wave, we're going to have a second, and you hit the nail on the head. This was predicted a year ago. So you do have that experience, and I'm appreciative of that you're part of that health department team. Because I said it the other night in my State of the City, I think we've got it right here. We just need to continue. Turning the corner all of a sudden gives an indication that game's over. I just don't want to lose that final push. And to me, it's getting the vaccines in the arms. I mean, that's really the critical part.
And that's it. That makes a difference because there usually is a third wave to pandemics, but the third wave gets much muddier and lower. Usually the illness severity is worse. But like H1N1 was not done in 2009 or 2010, this is not going to go away completely. It's not going to disappear. But certainly I hope we have, if we have to experience another wave, I certainly hope we have a puddle wave instead of a big wave.
So I know Commissioner Groninger is on the line. I just asked him to make a few comments from the county perspective. Again, their management of the health department has been stellar through this whole thing. So any thoughts or comments, Kerry?
You know, I guess just, big thanks to our health department and all that they've done through this. You know, the game's not over, but I think we definitely can see some light at the end of the tunnel. So kind of having that hope at the end of it that, we're going to get through this and we're getting close. I guess the thing that I'll say is, and once we have the word that those other additional vaccinations are available, we've already been meeting with the city, the health department, local hospitals, and other people to make sure we can staff up when that opportunity does come. So, I mean, we're trying to be as proactive as we can. So when we get the call, we can start to put those wheels in motion to make it happen. So, I stand behind our health department and continue to support them any way they need or whatever they need to make it happen to finish get this thing across the finish line. So, super excited about where we're at, and just feeling pretty good that seeing that curve come down to where we're getting down in the low double-digit numbers per week is really great. So, thank you.
Thanks, Kerry. Appreciate it. Appreciate all your support and help. I know from a city perspective, we had a department head meeting this morning, and we're trying to project out this summer activities and concerts and that type of thing. And I know we're kind of feeling better about maybe smaller concerts. We're still going to have to make a decision on our large concerts. Again, depends on the time. It depends on, again, what happens here. I won't hold you to any of this because we just don't know, but what are your kind of prognostications for maybe late summer, early fall, where we might be as far as gatherings?
I hope that will be pretty good, that we'll still remember maybe to be cautious, but that, I'm hoping that we won't have limitations at that point.
It's great to hear. I think we all feel the same way. But again, I think we're heading in the right direction. Turning the corner, if you will, is good. But again, we got to get these vaccines into our communities, into our clinics, into our serving lines, and into arms. And I'm feeling good. So, any questions, Amanda, Times Union? So, and the only reason I want to repeat the question, because I'm sorry I don't have the microphone on, but Amanda from the Times Union wants to know how the contract with the testing site through June at the fairgrounds will be extended if necessary, and how that could interfere with the fair. I don't know what the plans are for the fair, but Teresa, you may address. I know that the county has a an agreement with the state to run that clinic through June. I don't know
I'm not
beyond
sure.
that.
I think we're still running in a just-in-time status, and I don't think we know where to project that out that far yet.
Kurt, I know, obviously from your side of it, the testing is way down, but I would think we'll still need to have some sort of testing site for a while, but I don't know, any thoughts on that question?
Yeah, I mean, we're still staffed to be able to handle the testing and the hotline, and we're committed to doing that through the end of the contracted period, and if needed, even beyond that. If it becomes a problem at the fairgrounds that either their traffic is interfering with us or our traffic is interfering with them, then we might have to find another location. Again, we originally started in the parking lot of our new health clinic there off Providence Drive. We could conceivably move it back there or to another location that's convenient for the population of the county.
The good news is hopefully the weather will be more conducive to a drive-through outdoor clinic then. That, I know that was obviously the concern, so I would assume those adjustments can be made, but I don't know if that contract, if the county or if the state, because the state was the one that approached county, said we've got X amount of dollars, we've got equipment, we've got, you know, the testing supplies, we've got the access to the Zotex system. Here's all this, all you have to do is staff it, and then here's some money to help do that. So the state was the one that decided that the county needed a specific permanent site, if you will, and that contract runs through June, and beyond that,
We'll see.
there's nothing in that contract to extend. Obviously, nobody really knows, to be quite frank. But good question. Good question. And I can assure you we'll have,
Testing,
we've been
so.
concerned about testing from day one, and we will continue to have that testing available. Like I said, Kurt, it could be back out at Bowen Center, it could be down at Central Park, it could be certainly anywhere, but the weather and the lower numbers will probably make that a little easier to make that pivot. Okay, Nick, anything?
You covered my questions already, so.
Okay. Well, Teresa, any final thoughts, or Carrie or Kurt? Nope.
Good.
Yeah, maybe I can mention we track the staff, the Bowen Center staff who've gotten the vaccination, first shot, second shot. We count them all by department, and so far we're about 36% of our 1,500 staff have been vaccinated, either the first or both shots. And we look at it by department, and some of our departments have 50 and 60% of their staff already. And I've got a very young staff, so a lot of them just haven't even rolled into the age frame, and some of them are direct care workers who are face-to-face with patients every day. And of course, they qualify because they're healthcare workers who are potentially at risk. And so I'm pleased with those numbers, but the goal is to get it to 80% or more. And I hope the whole community can rally around that sort of a target, and we need that for all our public health.
Yeah, at our department head meeting today, I think probably about a month ago, we made the vaccine education mandatory for our employees. In other words, we wanted them to sit down and view a couple videos, and all department heads reported that everybody had gone through that vaccine education. So hopefully that's helpful. Some of these videos they watched are done in a very simple, very effective way, with pretty plain language, and really debunks a lot of the, I would call pseudoscience that's trying to discredit this whole thing. But as I said the other night, vaccines are our way out, and they're here, and they work. So, all right. Well, listen, we'll be back in 2 weeks. Thank you very much. And Kurt, that number one more time.
That number is, I'll look in the right place this time, 347-4256.
All right, great. I think we'll end on that. Thank you.
Okay.
See y'all.
Thanks, everybody.
Okay.
Yeah, Amanda, I looked back on my calendar